Hi, I'm Dr. Yara Robertson. I'm a breast surgical oncologist here at CARTI Cancer Center in Little Rock. I'm also considered a high-risk patient for breast cancer. I've been identified as being a high-risk patient because of my family history. Some of my patients will have genetic tests done, and it shows that they have no gene mutation for carrying breast cancer. However, in addition, we calculate the risk. So my risk for developing breast cancer was calculated in our breast center, and I was found to be greater than 20%. Now, I don't have a genetic mutation for breast cancer, but because my risk was greater than 20%, I've been identified as being high risk for developing breast cancer. And that changes my screening exams. So once you've been identified as being a high-risk patient here at CARTI, not only do you do your mammograms, but in addition to that, every 6 months, we have clinical breast exams, as well as you get a high-risk MRI, or we do ultrasounds of the breast. So a lot of patients are claustrophobic when they have their MRI, or they have an idea of what an MRI would be like. I have to say that the MRI here at CARTI was very comfortable. I had my face down, but they had an area for me to put my face through. There was a mirror, so I didn't feel claustrophobic, and the ladies talked me through everything. It was very quick in only 18 minutes. Patients have a false sense of security sometimes when they do their genetic testing and it comes back negative for a gene mutation. If you have a strong family history of breast cancer and you have dense tissue, all that goes into the calculated risk. If you've been on hormone replacement therapy, when you started your menstrual cycle, when you entered your menstrual cycle, and also it depends upon if you've had a breast biopsy showing hyperplasia or any of the atypical cells. All that goes into your calculated risk, so you might be greater than 20%. So I want to stress that even though you may have a negative gene test, you could still be high risk and you still need to be followed. Only 10% of patients who develop breast cancer actually have a gene mutation. So most patients who get breast cancer are actually because they're female and older and have nothing to do with the gene mutation. You have something that might be missed on mammogram, and possibly it can be picked up by ultrasound and MRI instead. So I would suggest that if you are a high-risk patient, meaning you have a strong family history of breast cancer, you need to talk to your provider about your risk for developing breast cancer, and if your calculated risk is greater than 20%, you can come to CARTI to get your supplemental imaging done.